Hey my royalty, welcome again to another video. Thank you so much for coming by. If you don't know me, my name is Royalty. I bring you guys reviews. So today let's get right into it. Today I had surgery and I had a meniscectomy, and that is basically when you have a torn meniscus. You get it either repaired or removed. So I wanted to bring this video to someone that might be having this surgery, don't know what to do, what to expect. So I really hope this video helps somebody. Hey my royalty, welcome again to another video. Thank you so much for coming by. If you don't know me, my name is Royalty. I bring you guys reviews. So all right, excuse me, I am a little groggy, so just bear with me. So today I had my surgery, and basically what happened was I tore my meniscus at the gym. I did extension exercise and I went super heavy. Bear with me, I'm also looking at my phone because I won't remember. I'm feeling super loopy again. So I did extension exercise and I went a little heavy and I felt a little pain. So how did I know I had a meniscus tear? Well, it was hard to walk. I had excruciating pain in the middle, in the inside part of my knee. I'm gonna show you, like right in here, or you could have it on the outside. You could have a medial or lateral meniscus tear. So I had a medial meniscus tear. Excruciating pain. When I went to sleep, it felt like someone was lighting a match on my knee. A lot of burning, just ridiculous. So basically what I did was I went to orthopedic doctor. Shout out to Dr. Wodicka at Holy Cross. I love Holy Cross Hospital in Fort Lauderdale. They are the best for orthopedic surgery, hands down. This is actually my second before. So hands down, Holy Cross, shout out to you guys. So good. So how do they determine and confirm? I had an MRI. So what exactly is a meniscectomy? Basically, they have like 3 holes, so tiny, not invasive. They use one of the holes for the camera. That worked for me. Icing, you know, a lot of flats, comfortable shoes, and the driving, especially for a medial, will be excruciating. My doctor did say I can continue to exercise. I couldn't do any extensions, so I was continuing squatting, the bike exercises. I did spin classes. So that kind of kept me maintained as far as prior to my surgery, because I needed to keep moving, and the spin classes and the biking really helped to just keep the blood flow with my knee. Also a lot of stretching. Oh my god, lifesaver, lifesaver, lifesaver. This is, like I said, all before surgery that I did on my own. I did stretching, I did biking, I did the icing, I let go of the heels, I, you know, wore comfortable shoes, and I stretch like crazy because the nighttime is when it's so bad. So enough rambling with that. So the things that I had to do before my surgery, I had to get a medical clearance from my primary care physician, checkup, and then I had to have a COVID test 3 days prior to my surgery. You know, all the hospitals are doing that now. You should really know all the medications you're taking, even your vitamins. So kind of go through that, write them down, put them in your phone. Cardiologist needs to know that information so that there are not any side effects. Also, very important, of course, this is all my doctor recommendation. Your situation may be different, so I'm just explaining to you my experience. I had to let off all kind of Excedrin, because I take Excedrin for my headaches, for like 5 to 7 days before. Of course, no alcohol. So I couldn't take, the only thing I could take if I had to for pain was Tylenol, extra strength Tylenol. It doesn't recommend it. I hope this video helps you. Just ask, because it was told to me that you have to let off that medication. So I hope this also gives you a guide of questions to ask if they don't bring it up. Again, this is my situation. Every doctor is different and every surgery is different. So I just wanted to put that in there. Okay, so what did I get before my surgery? You have to wash the night before and the morning of with this heavy cleanse. Find it anywhere. You could get it on Amazon. One of the things I do recommend is getting some lozenges, because they do put a tube through your throat and it is so annoying. It's scratchy. They say it goes away in a day, but this is helpful. Also, I would also recommend that you get some waterproof bandages. Kind of the large ones was recommended to me by my recovery nurse, to get the large ones to cover it. Also, saran wrap is good as well. I would also recommend that, because let me tell you, keeping that suture site dry, for me, the way they kept telling me, is so important. It can actually stop the healing and cause infection if it don't keep dry. So I'm gonna keep this bad boy dry like nobody's business, okay? I'm not trying to go back and do anything with infections or anything like that. So if I gotta bubble wrap my damn knee, I'm gonna bubble wrap my knee. But yeah, I would definitely invest in that, because that is definitely hands down the most important thing, to not get water in that suture site. So another thing I recommend having on hand is good old extra strength Tylenol. Now, they gave me the goody goodies, okay? They gave me the goody goodies, that oxycodone. They gave it to me. But one, I'm not really in a lot of pain, right? So I'm not gonna take something that I really don't need. We know this can be very addictive. We know this can constipate you. So yeah, I have it on deck just in case, because you never know. The anesthesia wears off and there's a whole new situation. So I want to be prepared, and the doctors definitely prepare you and give you a script for your medicine. This extra strength Tylenol usually works for me, and so I'm gonna try to give this a try. They say at night is when the pain is most intense, so I'm gonna keep that in mind. Please, you have to have someone drive you home. I'm sure they're gonna tell you all of this. I got there to the doctor's at 7 a.m. okay, 7 a.m. registering, doing all that stuff. And then I was pretty much in my bed with the IV and everything in my hand at 8. Saw my surgeon, saw the anesthesiologist. Everyone introduced themselves. So professional. I love Holy Cross. Say I was in surgery by 8:45. The surgery itself is like 20 minutes. It's a 20-minute surgery. The arthroscopic surgery, recovery time 30 minutes. Relaxer, little cocktail before I went into the operating room, so that kind of calmed my nerves. I wasn't really that nervous. I don't know why. Maybe because I had it done before. And so that relaxed me, and then I went in and I was out. Hey guys, something else I wanted to tell you guys that you would need to prepare is definitely like a stool softener, because sometimes the pain pills can cause constipation and you do not want to have that. Sometimes you also get real itchy, so maybe like having some Benadryl on deck would also be helpful to help with another thing I would definitely do invest in going to the supermarket and getting the proper nutrition that you need. I was super hungry because of course you cannot eat past midnight the night before. Some of the recovery foods that were recommended to me were like protein. Of course, you need protein, so a lot of eggs and cottage cheese, poultry, fish, nuts are excellent source of protein. C, which helps your body make collagen, of course. And when your body is recovering, healthy connective tissues and collagen is basically what those ligaments and tendons are made of, right? So definitely the vitamin C is important. So you need calcium. The mineral is not made up in the body, and our bones are continually losing a lot of calcium, so we need to consume it, and so that our bones can be strong, right? Because at the end of the day, this meniscus is attached to the bone. So if the bones aren't strong, you know, it doesn't have anything to really strong to anchor with. So a little list, just to start a list, or you know, like milk, cheese, calcium, or spinach, kale, and chia seeds. They're loaded. Vitamin D, you need that vitamin D. You know, you got your orange juice, your milk. It's not anything that we could put on to help. So we have to really load up with the right foods so that we can have the proper healing. Because I'm looking at that white wine, trust me, in my fridge. I'm not gonna lie to you, I really am. Loopy and all, I'm looking at that rosé. But alcohol, cannot have any alcohol. Caffeine, I did want to stop at Dunkin' Donuts. All the things I want, I can't have. So caffeine, alcohol, sugar, and of course salt, they can all slow the bone healing and just the healing process in general. I got my TV on deck. I'm like, you know, it's like time for me. My puppies are begging for attention, and I love my puppies, but so it's important that you take care of yourself so that you don't have to go back. I'm telling you, my left knee, hands down, has never given me problems, so I'm really excited for the healing process of this knee. Hope I covered everything. I hope that I helped someone out. Again, today I had my surgery, so I'm talking to you guys looking crazy and feeling a little loopy, so please excuse me. I just hope that I help someone that is preparing for this surgery. Don't be afraid, ask the questions, prepare, and you'll be all right. I wish you guys a safe and speedy recovery. Again, thank you for watching. If this is something that helped you, please hit the like button, subscribe to my channel. I'm just always coming to you guys with important info that will hopefully help somebody. Love you guys. Be royal, be blessed. Bye.